And you know the only time you are going to stand up is when the delivery guy is out there to drop their food. And once they pick it, they are back. And this is a routine that kept on happening. And then we now check life expectancy. We see that we are one of the lowest on the cadre of life expectancy. Why? Because of habits that are affecting our health and making us feel less of other humans that live better in other places. So this is what brought about human health and habits. If we have good culture, good eating culture, good sleeping culture and all that, maybe we would probably be at peace in a way with life for ourselves. But of course, most of this culture, we are not building it. We don't even care about it. And amazingly, we are ignorant of it. So, that's why we have you, the professionals and practitioners here, to guide us, to help us. Because, like I said, it's more of the people who are not going to be in this space. We'll be live streaming soon. Of course, we also have it well recorded and will be edited and split into bits over time. But these messages have to go out. You see skits about things that are not adding values. So we felt like, okay, what can we do to make humanity better? Last month we talked about legal system and lawyers, how it matters to everybody. People don't know they need all these things they run into the net of law, into the net of health, and I hear the doctors are not considerate at all. They just come and they just do anyhow. But you actually did anyhow before landing at the doctor's nest. Probably if you don't do anyhow, you will probably find yourself, like my own usual habit, I do a lot of ABBA. And of course, at a point, I realized that I was going into the edge of the extreme. The ABBA tea I was supposed to take maybe once in a week, I was doing it almost every other week. Do you understand now? I was enjoying it. It was giving me energy. It was giving me the keep going vibe. But at the same time, I was also hurting myself. As much as it was helping at a point, it was also affecting. So sometimes we are ignorant of this knowledge that we need to know. And that's why we have this session. And of course, we'll be looking at the session as it gives us the privilege of time. Everything we're looking at is just going to be about 90 minutes in actual sense. But we are starting any moment from now. And of course, today, I'm not the moderator. I will introduce the moderator and I will introduce the panel. And of course, we would have ourselves enjoy the moment. And for the people who missed the last edition, so they can also still visit our handles on legal matters, tags, and all that. We have all those ones going on there. Then, my father always says something. You don't know the cost of a thing until, not when you need it actually, when you urgently need it. You don't know the cost of every one of you that we have here who have volunteered to pass on the knowledge that is at your disposal. Until I have to come to your office and I have to pay to see you. I have to fill a form. I have to book an appointment. I have to wait on your busy schedule. And we want to say thank you for being here. Like, we have some other practitioners that will be joining us as the program is going on. And I must tell you, they have to leave their shift in UCH just to be here and say, okay, let me just give to humanity. Do you understand now? So, of course, we appreciate everybody that is giving to humanity. And of course, we pray that God will give you the best of reward. The first panelist I will be inviting is no other person than a distinguished public health specialist, social worker, and a PhD candidate of the University of Ibadan. As the CEO of Cassia Social Support and Mental Health Services, and the lead of Project Hope at Asido Foundation, she operates at the vital intersection of clinical research and community action. A certified global mental health professional and WHO MHGAP trainer. Her expertise spans child and adolescents, very awesome, adolescent mental health, trauma counseling, and reintegration of marginalized population across Africa. Currently, serving as the community support worker supervisor at the Succeed Africa project. I welcome with me Doctor in View Rita Oni Setia. Oni Shaitan, sorry, Oni Shaitan. And we welcome you. Please kindly come over and make yourself comfortable here. We appreciate your time. We appreciate volunteering for us. Another NEPA clap for her.
Thank you.
Do you know NEPA clap? Another one. And another one. Thank you. Yeah, we have style of claps, you know. So thank you so much for coming. Thanks for joining us. And the next person I will be bringing on board, is no other person than someone who is a seasoned health insurance administrator and head of programs at National Health Insurance Authority, Oyo State Office, with extensive experience in public health financing and social health care insurance. Madam Yusuf has been a forefront of driving universal health coverage UHC initiatives within the region. He is widely recognized for his strategic leadership in program implementation, stakeholder engagement, and his commitment to making quality healthcare affordable and accessible to all Nigerians. A dedicated advocate of health equity. His work focuses on bridging the gaps between policy and grassroots impact, ensuring that health insurance serves a sustainable tool for national development. Welcome with me, Madam Hassan Yusuf, on the podium. Thank you, sir. You're most welcome, sir. Yes. Our last panelist would. No, he's a man. He's coming. He's a man. And our last speaker is a man who will be here soon, and of course, he's also a pediatrician, and I will be reading his citation when he's here. He's on his way. He had some delays in UCH. You know how it can be with handling kids. So, of course, we have our powerful moderator. Welcome with me, Miss Kumi.
Thank you so much, sir.
Okay. Please, let's go ahead.
Welcome to Leaders Lounge, second edition for 2026. Today we are dealing with human health and habits. We'd like to welcome every one of you. Welcome, sir. You're welcome, sir. You're welcome. So my first question will go to Yuma concerning human health. I'd like to ask you what are things that you can advise us concerning our health as human beings, concerning our health. What are the things that we are likely to know concerning our human health?
Okay, thank you very much. Okay, thank you very much for that beautiful question. Can you hear me?
Yeah.
Okay, thank you. Human health. Let us start with the definition of health. Anyone in the house? Okay, I'll take it. Okay, health is a complete state of well-being. And this complete state of well-being does not just say the physical. It is complete. There are three stages of well-being, which is the physical, the social, and the mental health. And I guess I'm here because of the mental health. He's here because of the whole of the
insurance.
Yes, the insurance for our health now. Okay, so what I'm trying to say is that there are three aspects of human health that we must take serious. To have a complete state of well-being, we must take care of our physical, which has to do with the one we can see, our social, the relationship with people around us, and most importantly, this one that a lot of time we don't pay attention to, or that we tend to sweep under the carpet, which is the mental health. You know, you can't walk. Let me not say you can't walk on one foot, because it's possible to walk on one foot for some people. However, you can't have optimal health without mental health. If we remember, there's this player at some point he was sold into another club. It was when they were doing general physical health that they found that he had a hole in the heart. Does anyone remember? Yes, Canon, thank you very much, sir. A good football. Yeah, I'm sure he must have played a lot in his young days. Or maybe he still plays, sir.
I don't know.
Then you should just try and jog and shake body, because that's part of what we need to do to stay healthy. So, he had a complete physical state of health, right? But there was a hole in his heart. You didn't see, you wouldn't know. So no one has it in total, but to stay healthy, to tick all the boxes, take care of yourself. Go do regular routine checks. That is high blood pressure, do your blood sugar level, visit your doctor regularly. Every time, you can do it maybe quarterly or every half of the year or yearly. Especially as you approach 40, it is important that you check and say that you are doing well. Then the mental health, our mental health status, we have to take things easy. Yes, Nigeria will whine you, but you shouldn't do what? No panic. Nigeria will whine you, but no panic. So let's not panic. Everything's going to be alright. But let's live one day at a time. Because we tend to, just like you mentioned when he was introducing that, we tend to take a lot of things on our mind and say, oh, that $1 billion, I want to make it to them. It could be possible, but so that when that $1 billion is ready, you are still there to enjoy it in good health of mind and body. So the good health of mind and body is what goes on in our brain. We also have to take care of our mind, sleep well. It is important. Statistics has said that, I hope I'm not talking too much. Okay, so statistics has said that, research has said that 1 in every 4 Nigerians will have mental illness in their lifetime. And we know, okay, for instance, we have a family now. A family of father, mother, and their children. Mass children that people are having now is 2, Abby. So let's now take a whole family, for example, which means one person in that family will probably experience mental illness in their lifetime. It now depends on the level of the mental illness or the challenge. So that brings us to the fact that we need to take care of our health, both our physical, social, and mental illness. We also believe that the spiritual health is also a way of, helping people to heal. So we do not take away human spirituality from their health, because some people believe that when they need something, or when they are trying very hard, they pray or they do meditative prayers. Yes, it works, but it can never replace our mental health care, our physical health care. And if you really want to enjoy your physical and social health, you must take care of your mental health optimal. To enjoy optimal mental health, do not joke with your mental health, because there's no health without mental health. The pot seat in the olden days will sit on 3 stones. It cannot sit on 2 now. It's not possible. The pot will spill. So please, our health is very important. Set healthy boundaries. Sleep well. Eat well, eat good food. We're not saying you should go and buy what you cannot afford, but there are simple, balanced meals that you can eat that helps you to stay healthy. Then exercise. Exercise is the cheapest. You don't have to pay anyone to exercise, or those who don't have time to, follow the gym routine. Let's do physical exercises now. If you walk from this corner to this corner, you do it brisk. And set your time, okay, I want to do this for 30 minutes, and you must be consistent every day. Before you know it, you lose weight. Do it like 100 times. You won't even know. Just set the timer, and when your alarm rings, you stop. You won't know how long you've gone in a day. So that's another way of also staying healthy.
Okay, thank you so much, ma'am. Thank you so much. Well, you're enlightening us more. So the next question is this. We people, like everyone, we do think that health insurance is something costly that even some people cannot afford. What can you encourage us concerning? Like, what is your own view concerning it? Because a lot of people are like, okay, health insurance is costly, they can't afford it, so some people don't even take it very serious. Some people don't even think about it. They just like, okay, health insurance is for the rich people, not for the poor. So what can you encourage us concerning it?
Thank you very much, and thank you for having me. She just said what health is, or have just defined what health is. Next to life is health, and not just health, but good health. Now, how do you sustain good health? This is why we need a health insurance. Imagine those of us under this roof and those outside this roof. Who is better protected? Those outside are exposed to a lot of vices, maybe the sun, the rain, and everything. But those of us under the roof are better protected. And so is the need for health insurance. Health insurance in itself is just a tool, a mechanism for sustaining or for financing healthcare. Is a means to financing healthcare. We need healthcare and we need to sustain it. We need to protect our health. Now, how do we protect? We need a health insurance. And that health insurance is the tool or the resources, because health insurance has two principles. One is that it pools resources among groups of people and it shares the risk. There are a group of people that have different incomes or different health challenges. So, but when they contribute into a common pool, then they can share that risk from the central pool. I don't know if you got what I'm saying. The principle is two. Health insurance works on two principles. One is pooling resources among group of people. We told you the health insurance itself is a tool for financing healthcare. It's a healthcare financing tool or mechanism. So, and that works on two principles. One is pooling resources among those groups and then sharing the risk within those groups. You understand? We will not all need the same type of health intervention at the same time. And not at the same time that all of us will need to healthcare. But when there's a pool of funds among the group contributed, then anyone that perchance take ill can have access to the fund. So that takes us to social health insurance. Social health insurance is a social security system that guarantees the provision of needed healthcare for a group of people upon payment of token amount at regular intervals. Perhaps I take that again. Social health insurance is a social security system that guarantees the provisions of needed healthcare upon payment of token amount at regular intervals. So that is the same resources we are talking about. A group of people coming up with some contributions at regular intervals to take care of their health challenges. Now, going forward, how does this program work? How does the health insurance work? For us in Nigeria, there are so many types of health insurance. There are those that are taxation based. There are those that are contributory. And there are social health insurance as well. Social is such that you have a group of people, like I said earlier, that will contribute into a common pool, and then they will take care of their health challenges. So, and that's the one we adopt in Nigeria. So, health insurance operate in such that for us in this country, we have been able to stratify the population into different categories of people. We have the active government workers, you have the non-government workers, or let's say the informal group, that is people in the artisan groups, different shades of workers that are not on regular income. The formal sector groups are the regular income earners that are either in federal government, state government, or organized private sector like banks, industries. So these people, because they take regular income on a monthly basis, it is easier to attract their contribution from their monthly pay. But for the irregular income earners in the informal sector, they are not sure of what they earn, either on daily basis or monthly basis. So it is difficult to have a fixed amount for them. Rather, is to know what the group needs and then base their premium on the kind of health challenge they want to be covered for. So for now, that is why we have. And also, going forward, there are certain groups in the society that are paid for by government, like the inmates, physically challenged, or vulnerable groups. They belong to a group that government pay for them fully or directly. Also in the organized private sector, because it's easier to attract that contribution, it's the same thing applies. But in the informal sector, it is individualistic. So contributions are paid or premiums are paid based on individual basis.
Thank you so much, sir. My next question to you.
Okay.
In this world, how people prioritize busyness, how can we balance our work time together with the rest time? Okay, fine. Everyone is saying, okay, we have to rest. According to what you said earlier, now, we have to rest while working. How can we balance the both together?
Okay. Thank you very much for that beautiful question. My understanding of this is work-life balance, Abby. The answer to it is self-care. We have to prioritize our self-care. Now, we have to work. And let me take the example of my Oga here. He explained earlier that in this workspace, we have people who work like, you don't have to work so hard to prove your worth to people, or to end that goal, but we have to work smart. However, because you work very hard, and I'm an advocate of rest, because if you don't rest, if you don't give the brain time to repair, then it's a big problem. It could affect our functioning. Hence, let's set boundaries. These are some of the tips we can use. Set healthy boundaries. Okay, going forward, because my general health, in fact my mental health is important. I work from 8 a.m. to 10, I take a break. Maybe about 10 minutes. You may not have the time to sleep, but just sit, relax your chair, and roll around like a baby. Roll around on your seat, though, even if you can't go out. If you don't have the strength to go out, roll around like a baby. And do this grounding exercise. Let's play with our sense organs. Your tongue. Imagine that you are still that baby, or you were still that baby, your best food as a child. It brings back childhood memories, good childhood memories. The best food that you like people to serve you, that food that makes you feel good, feel happy. It releases feel good hormones within your system. that helps you to recover all the energy that you burnt. It releases dopamine that, rejuvenates and helps you to continue for the rest of the day. It could be that you just contract your toes or hold your fists just to release the energy that you spent. Again, it could be that you don't take too much, or learn how to say no politely without being seen as rude. Because they see you that he likes to walk. Don't worry, just give him, he will do it. He will do it. Even when you know you are breaking away, when you are tired, you don't know how to rest. I have to meet my target for today, I have to do it. Boundaries will help you keep safe. Will help you to stay healthy. Set healthy boundaries. Learn to say no in a polite way. I mentioned earlier that we should exercise. If you're not able to get out of the workspace or out of your house, you can do it within your house. Or you can have the small rings that you can carry within your space. Or just simple exercises that you go up and down. And if you know how to exercise in the other place too, you can do it in the other room. You can also do that. Why not? However, sleep is important. I said it before, I'm saying it again. Sleep. Make una dey rest. Make una dey rest. Sleep is important. When you sleep, have I explained the meaning of mental health? Maybe I haven't. See, when you rest, you are able to do things better. Have you ever, let me ask, has it ever happened to you that you saw an answer to your problem in your sleep? You've been trying to unknot something. You've been trying to crack something. And while you rested, the thing just occurred in your dream. Has it ever happened to anyone here? When you rest well, that thing will come back to you when you're awake. Or you can just quickly wake up or sometimes I use recording. I just remember something, I'll just record it in my sleep. I just call out on my phone, I say, okay, record this. That's just the magic sleep can do to you. And by the time you wake up, that thing you were spending 3 hours to achieve, within 5 minutes, you are done. Because you have renewed energy. That vigor comes as if you took something serious. No, it's just sleep. Sleep has that much effect on our brain, on our system, on our feelings, on our behavior, on how we also relate with people around us. Then, if you feel that you are distressed or you're having sleeplessness, you are not able to sleep well. How many of us here sleep for 8 hours? Thank you. That's beautiful.
If Mary should raise up, if Mary should raise up her hand.
Do you sleep for 8 hours?
But not as stretch.
Not as stretch, but for how long? How long
Within
do you sleep
24
at
hours.
night?
At night I take about 5 to 6.
Okay,
because
so
I sleep by 10.
Okay.
Wake up maximum 4.
4.
Some 3:30 or 4.
Or do you wake up immediately? Do you stand up immediately? Because sometimes it's not active sleep. You don't have to do active sleep to rest. Like I explained earlier that you can just be here, just rest your back, be in your most relaxed state.
Without pressing the phone.
Without pressing your phone.
Why do you have to say that one now?
Yes, without pressing your phone.
That's also.
Yes, because phone is also a stressor for us. I hope you know that.
Yes.
There's this app that helps you to measure how long you use your phone in a day. Then you see that phone is one of the, like Yoruba people say that, the enemy of man. The village people, as good as the phone is, it's also an enemy of man, because when you are sleeping, once your phone rings like this, or just a message, just simple message, you are home. it has distorted your sleep for the rest of the day.
Why don't you off it before you sleep?
Maybe not off it, but just keep it away from reach. Because that's what I do. I keep it away from reach. If you say they should off it there, I don't know what will happen. It's a go without their phone. It's a go post. So that they'll miss that $1 million alert.
But if the alert will actually come in, it will go in now, it won't go out.
But
there's a
let us start.
I need to close it. I need to close it. I need to close the acknowledge it.
Because of family.
For emergencies, yes. I don't keep my, I don't switch off my phone for emergencies. But however, we can put the phone on vibration or silence.
It will still wake you up.
I don't think vibration. That's why I said that. Keep it out of reach.
DND.
What is DND?
Do not disturb.
Okay. Yeah, do not disturb that does not let the phone ring. Oh yes, we do that when we are in webinars, when we are in trainings and the like. So we just miss your call. I think that is best. So you miss the calls, but for emergencies, I think I can do that because sometimes we have to respond. So, but if you really want to be serious, promise me that you're going to be serious with your health this time.
I will try to.
I will sleep.
Mary, let's promise together.
I promise to rest. I promise to sleep.
Mary, we promise to rest.
I promise to stay away from my phone.
We promise to stay away from our.
I promise to keep good company that helps me to.
Are you taking both?
Yes, so
No, because I've gotten to that stage. It's looking like they will not do it.
honestly, we are very, very.
Everybody's addicted
Addicted to the phone.
Very addicted.
So please, let's try and
So I think we should speak to that habit too.
see,
Because it's a mental health too.
yes, sir.
Of course, it's a mental
You're
challenge.
correct.
Because if you are addicted, addiction is not only by drugs.
Of course.
So, and this takes us to the role of will. Are you willing to actually say no, yes, to this habit? Yes, there's a problem. There's the problem we have identified now is habit. Habit?
Yeah.
It is not
It's not
village
contagious.
people, it's not contagious,
Communicable
it
disease.
is not a physiological problem, but it is what we have chose to do. And we have now let it control how we behave. Our lifestyle, our relationship with people. It can be here with me. Hi, sorry, I still have the baby behavior because this is how I relax. As I am, I'm relaxing. I've been standing since. I just came out from the international UN migration training for returnees. So I've been on my feet, teaching them on mental health, training them. So me, I'm relaxing as I am. That's why I'm moving the chair. So that's my moment. That's why I said you can do it easily like this. And you are relaxed, but I'm talking. But for me, I'm relaxed, so that's why I'm shaking the chair, I'm moving around, so don't mind me. So if we have allowed this to alter our daily routine, how we relate with people around us, how we take care of ourselves, then it's a big problem. It's not, if it now affects who we are.
Now work like robots.
It is not healthy, it is not safe. And I think you know what to do. You can seek help from professionals. But if it's not so much, you think you can help yourself, take a decision. Decisions that you can make, smart ones. Not the one that I said, I will switch off my phone like somebody said here today. You know that is not possible. But if it is to start with, let's put it on silence or vibration. Or don't even put it on vibration. Put it in another room. Or leave it in the kitchen and you sleep in the room. And reduce the volume so that it doesn't ring. Some people are really thinking that it's like tired. I get it, I can understand.
Why would I do somebody's hand coming inside the kitchen?
You see? And you can put it in one of the kitchen cabinets. Nobody will find it there now, Abby.
He's just trying to get it close to him.
We know now.
I think what we should address is that it is a mental problem because of that attachment. So how do you bring yourself up?
You also need to talk about why we are doing it.
Okay.
Sometimes we are doing, some of us are doing, some people are doing for justifiable reasons.
Justifiable reasons like, please?
Like, they have to be in touch with their customers.
Even when you are supposed to be sleeping.
See,
Some people have to do
Between 10 and all activities should go to rest.
Sure, you know that God that created day and night has a reason.
That is they are talking about normal rest by default. But there are some people, for me for example, I have someone, let me say a customer that if it's not 9 p.m. or 10 p.m. she will not call. That is when she wants to have that conversation about what we are doing. So at that time, what do? Not pick the call?
No, you can try not to adjust to your own lifestyle.
See, I said, no, she's the one giving you money.
You're not kidding me. You're not my
See,
you're not my father, you're not my mother, you're not my sister, you're not my babe.
Exactly.
She needs you. And so you can
we need each other.
If you remember, I said earlier that you don't have to work your ass out to show your worth.
Yeah.
And you don't have to prove it to anyone. Whoever knows your worth will key into your routine.
Exactly.
And that's why I said boundaries. Set healthy boundaries. Nobody can set boundary for you. That's why we're just talking about it. It's an attachment problem, it's a mental health problem, is this only you.
Boundary, but the red lines. You don't call me at this time.
So that's part of the
If you
boundaries.
cross that, then
No, I'm sorry. Okay, let me tell you that I left a job because it was affecting my health and my family. That's the way of setting boundaries. And unfortunately for them, I started my own.
Wow.
You understand?
You sack your boss.
To hell with you.
Yeah.
Just like this. See your baby. Okay, oh, sorry, you have more questions for us. We're already doing interactive session.
Before you go for the next question. Okay, so thank you. And I think we have all been enjoying this session.
yes.
So I think we are all enjoying this session, and of course, like I said, we've been talking about mental health, we've been hearing about insurance, and a lot of us have been very rebellious to that habit. Like, I can see those freelancers, even the person I was expecting to embrace voluntary sleeping was someone sitting very close to me, and she's saying, no, who pay the bills? And I was like, so of course, while we are still sleeping in our own house, they are needed in their own facilities.
And I'm still going tomorrow.
And she's still going tomorrow. And of course, that's the reason why Dr. Subai is coming in this.
I don't say no because this is part of when I'm supposed to be resting.
Exactly.
So I can prepare for tomorrow,
Yeah.
but
No
for all of
boundaries.
us.
So now for all of us, she has
For
just
health's sake.
sacrificed for all of us.
For
So
you
of
and
course,
I.
his work as the intersection of clinical experience and community health advocacy makes him a leading voice in ensuring every child has the opportunity to grow, thrive, and reach their full potential. And with me, I welcome Dr. Subai Yusuf Olushola. Please kindly welcome to the podium, sir.
Thank you very much. Thank you, good afternoon, everyone.
So at this point, I want the moderator to keep it going from there. Of course, now you have your full panel. You have your full panel, and of course, you can now throw the other bombs.
I just harassed it now.
Welcome, sir.
Thank you.
We really appreciate you, sir.
Thank you very much.
So, the question that I'm going to ask you, the question, sir, is enlighten us more on pedestrian, pedestrian specialist, and everything we have to know concerning it, sir.
Thank you very much.
Please, exchange the mic.
Thank you very much. Good afternoon, everyone. I'm very happy to be here. I'm sorry I'm coming quite late. I've had this topic on, and it's really been on my mind. But unfortunately, today just went somewhat, and I couldn't just leave. And I'm so sorry. So just briefly, if we say we should start talking about pediatrics, we will not live here now. We will not live here. So, but just a brief. So pediatrics is just a section of medicine that takes care of children. So we take care of children from cradle to age of maturity. That's 18 years officially. So any child from the first day of life. Never forget, we have some children that are born preterms. And in truth, even here, we've been able to manage babies that are born as early as 25 weeks and they survived. They survived and they went home. 25 weeks about just 6 months. So even in Nigeria, it happens. So there's nothing like it doesn't happen in this country. It happens. So we've been able, even in private facilities, I'm managing babies 25 weeks, and they stay till they are good enough to go home, and they eventually go home. So branch of medicine that takes care of children from cradle, from birth, preterm, small for gestational age, up to 18 years. So pediatrics covers all aspects of those children care. So we also have subspecialty in pediatrics. We have neurology, cardiology, neurology of the brain, cardiology. So we have stuff like pediatric neurologist, pediatric cardiologist, endocrinologist. Interestingly, where I work, we actually have almost all the subspecialties. So we feel that we pride ourselves that Ibadan, UCH, is one of the very few centers in the whole country. It's the only center in the whole country that has about 12 subspecialties in pediatrics, which is amazing. So we tell people, come to Ibadan to train because we actually have things to train you very well, and you have all the patients. So that gives it gives a broad view of the kind of patients you see, it gives you the confidence. Tell me the case, you most would have seen it before. So that's just what pediatrics is about, and we do our little bit to take care of these children. As it said, we want to give all children the potential to be whatever they want to be, and we try to do our very best, because that next child could be the next person that saves the country. Thank you very much.
Yes. He also didn't mention that Ibadan is the only place that has a center for child and adolescent mental health, where we come from. So.
Okay, so the next question to you, is what are the most common health concerns for children in Nigeria, and how can we address it?
Okay, thank you very much. So generally, we have the big fives. And these big fives, they've been there. I'm sure only before I was born said they've been there, and unfortunately the big fives are still there. And in this part of the world, it's still malaria. We still have malaria having a bulk of our patients. Pneumonia constitutes, in 1 to 5, 17% of deaths. But the thing with pneumonia is worldwide. So I think pneumonia is more representative, because malaria is just, I'm sure if you go to the UK now, you're like, we know they see malaria for a year.
Everybody has malaria, yeah.
So at one time everybody has malaria. So malaria, pneumonia, diarrheal diseases. I think on the world, in the children emergency, we still have about 4 or 5 patients with diarrheal disease. It still occurs. Different things causes it. Mothers still use feeding bottles. So we still have different things causing it. Then there's this group that we generally like to call sepsis. So sepsis are like infections. Infections are actually very common in children. Our environment is not that clean. We get to some parents, in fact their health habits are terrible, and all those things predispose those children to infections. The other thing about infections is that there's this terrible thing. Let me just use this opportunity to talk about it. Every young mother, especially the unexperienced one, they feel that when a baby has a fever, it's teething. If there's anything we can take away from here, please, I beg all of us, it is not teething. I, as a person, have seen babies die from who thought it was teething. Luckily, I work in a new Memorial Children's Hospital where I see those ones that are very close to the community. And these babies come white, they are pale. What's wrong? Child has been having fever. For how long? 10 days. Why did you bring? In your shade. It's teething. The effrontery is what is there for me. The effrontery.
I don't think it's their fault, actually.
They are so sure.
No, usually, see, I also work in the community mental health. It is these elderly women
They are so
that said,
sure.
yes, it was like that when I had you.
Yes, that even your father, it was a long shade.
And you also boldly listen to them and they destroy you.
The baby will be hot and hot, days after days. They go from baby Rex to pecan to ibuprofen, and when the baby is dying,
they now bring to the
hospital. A few of them, well, we are lucky. Very, very few we are lucky. A lot more, we are very unlucky. If there's anything we can send out, please. If you have a small child, less than 2 years of age, if the child is running a fever, the first day you can use paracetamol. By the second day, please go to the hospital. Let them just be sure, is it malaria? It is not any, please. It is not teething. If that's the only thing we can put out there, we've just made everybody's day. It isn't teething. Go out there, please let them just do. It's so simple. In fact, pharmacists can do MRDT.
Yes, they can
Malaria, yes. I know my organ is on the NHIS. A lot of places are licensed. The least they can do an MRDT. Okay, it is not malaria. The health centers are so beautiful.
Primary health center.
Just take them there.
Trying.
Yes, they're trying. They're trying. Just take them there. They're going to do MRDT. If there's something I'm sure they do. They do MRDT. If they think it's malaria, they treat. And if it's not malaria, you're sure it's not. If it's infection, they tell you, okay, this is not malaria. It is not teething. Generally, the tooth erupts around 6 months in development, and usually by 2.5 to 3 years, the temporary tooth is fully formed, which is 20 set of teeth. Adult tooth is 32, which forms up to later ages. But by 5, 6, you have your 20 set of teeth. So it starts at 6 months, some even 3 months, the baby is worse. They say it's any. This thing starts at 6 months. Some may not start at 6 months, so they should just go to the hospital. It's going to save a lot of our children. So sepsis come at the fourth one. Then there's a group like others, which comprise of different things.
I think you need to emphasize to the public on this issue of misconception with everything AE. When actually does AE start?
He said that.
Yeah, I know it's
okay, from 6 months.
Yes, so a little bit about the teething. So the teething eruption starts at 6 months, and not all children may start at 6 months. Some may start much later, and so we tell mothers, even if your child does not start erupting to that 6 months, don't be worried. It's just different from all different babies, but most of the others start at 6 months.
Real symptoms?
So usually, so this is what happens. Teething is just a part of the normal development that occurs. So a lot of times, interestingly, I have kids too. We never had a teething joke, so I can see it. It's not that somebody tells me that
it was never any.
I was never any. I never gave any teething mixture. I can say that, and no one, not even the child. You understand? So I can say like we didn't have to do it. So what usually happens is about 6 months of life is when babies sit without support. That's when just Google without support 6 months. So when they sit at 6 months without support, they usually touch different things. That's when they have the freedom. You understand? And the mothers are glad. We are glad too that mothers can keep the child there. You can have your life at first as a mother. So everybody, it's a beautiful feeling. So they pick a lot of things. They can have infections. The second thing is that there's a natural immunity that protects the baby from malaria in our own environment that the mothers transfer to the baby. But this immunity wanes, it dwindles around 6 months of age. So, but usually first to 6 months it covers very well, but by 6 months the immunity dwindles. So the babies are very prone to having malaria. So malaria infections are common at those times. So teething in itself does not really cost anything. The only thing you can see is maybe the baby is putting the hand in the mouth, like feeling some irritations. It doesn't really even come with a fever. Well, even if the child has a low-grade fever, it's usually maybe like a viral infection which we don't assay for. But the most importantly, those other things, the malaria that they have at the time, the infection they have at the time, are the things that make them have this fever. Sometimes they have this throat infection, very common, it makes them to be very hot. A simple examination, just take them to a hospital. Doctor checks the throat, does a malaria parasite test, does a full blood count. They are home and dry. If you can get that on, we would have been able to save a lot of our children. So that's basically it. And it can go from 6 months up to 2 years, 3 years. And those things are very, very painful. They are very difficult.
I also felt because there's this breastfeeding is much at that time needed.
And for
Some
6
of
months.
So why can't that also suffice instead of going to bombard them with some drugs and all that?
Okay.
Okay.
So in truth, it still protects them a lot. What breastfeeding does more is it protects them from diarrheal diseases. So it does that a lot. That's why I tell mothers that if you breastfeed your child, how many of us are the females in the house? How many of us are going to breastfeed for 6 months?
2.5 years.
6 months exclusive, 2 years WHO recommends as much. 2 years
Especially in Africa.
Yes.
Third world country, what do they call it? Under civilized country.
Developing
country.
So the truth is that as much as once our goal is to do the exclusive, do as much more as you can do. But so breastfeeding protects a lot from diarrheal diseases. It also has, as you said, breastfeeding has a lot of anti-infectives, antibacterial, a lot, IgA, lysozymes, plenty, immunoglobulins, and a lot more. But those infections sometimes are picked from the floor. Malaria, as I said, I talked about bringing malaria prevention. Yeah, those things, they are not, sometimes there are a lot of terrible infections, sometimes they're not just the ones the breastfeeding community can clear. So sometimes they can still calm down the infection.
Yeah, some other fears that we have with the way breastfeeding babies these days is that the moment you go to hospital, they give very strong antibiotics. And you look at, would that child not grow to become very immune to those very strong antibiotics and become resistant to it? So I fear a lot for children when they bombard them with such.
Thank you. Beautiful question. Beautiful question. So there's something called antibiotic stewardship, which we try to preach and preach and preach and preach. And it's a growing concern. It's a growing concern because antibiotic resistance today is one of the biggest challenges facing the world in the healthcare balance. Terrible challenge. Reason, in the last say 20 years, there hasn't been a new antibiotic molecule that's come into the world. The molecules we've been using are like the ones we made more than like 20 years ago, which is like things like meropenem, some combinations, piperacillin, tacrolimus, some combinations. Our common drugs that we know are the ampiclot, amozil, fleming, erythromycin, cefuroxime, dazinat. And those are the ones we know. Rocephin. Rocephin is like, the version is too much. But in our own balance, we know meropenem, that when everything feels just relaxed, so give meropenem. But in truth, we started having children with meropenem resistance. Wow. Meropenem is like, for a child about 10 years, it's going to take one valve 3 times a day. One is like 21,000. So the child is going to take like 6 to 8 that one. Not stories. I had a child in the ICU, a 14-year-old child. Thank God the father is a car dealer. He had it for 14 days. Thank God he went home. When I look at the child, thank God he went home. 63K every day for 14 days. And we're doing meropenem and vancomycin. Vancomycin is about 6,000 naira. Yeah, that's like the biggest combination. But he was in the ICU, so we didn't have a choice. Glad he went home. Now, so we try to preach antibiotic stewardship, and this thing has to go to the doctors. I know Oga is the big person on the insurance scheme, and we need to remind the doctors. In UCH, we really try to do it. We try to start with the least kind of antibiotics we need to start with. The problem with research is actually that most of them would have come with an antibiotics, 90% of them. So you can't go lesser in most of the cases because you also want results. So you have to go start at that level. But I must tell you, the professors and in infectious disease units, pediatric infectious disease units, the Oladokuns and Ogumbosis, my teachers, would always be on your neck to do the right thing.
To start from the
lowest. And as I am, I remember something very important. I once worked in the rural community in Oyo, just the last church. And when I got there, they were given ampiclox, amoxil, and it was working. It was working. It was working. And I would look at them like, me, I'd have given Kefuroxime, I'd have given Augmentin. They were giving amoxil and it was working. So I found out that antibiotic resistance is really real. So if we go to those places that are not so open, let's not start exposing them. We can try. If it's a respiratory tract infection, let's give the amoxil, give a trial, tell them to come back in 1 or 2 days. If it's not, we can now go up. So that I think we should. So this part goes to the public, goes to the doctors, goes to the health workers. They should please follow antibiotic stewardship.
Thank you so much, sir.
And please, I just wanted to add that, yes, there's this thing again, because in the communities, they try, and you also mentioned earlier that you use herbal medication.
Yeah, I do.
So herbal medications are good, very good, because some of these medications were also gotten from herbs, but they've been tested. Abioga, they've been tested and verified, and they are in mud dressing. They've been tested on animals, and people have used it without any complication. But herbs, we don't know the dosage. How much herbs am I supposed to take to cure me of malaria? I don't know. So please, don't give them herbs. I was at Otitude. I came with one of our patients who picked a beneficiary from the road. So she had a 3-month-old baby who has been on the street since birth. Not vaccinated, not immunized, nothing. In fact, what they call circumcised. So the baby was not circumcised. A boy. The boy looked, I don't know how to describe him, like a skeleton. So the mother was on admission in our place in psychiatry, and I had to bring the baby to Otitude. And I saw a baby, a 2-week-old baby. They had to pass this thing for her through the brain, because the baby, maybe you also saw the baby. And when I asked, they said, it's the mother-in-law that gave her he said for thank you.
Please, you have to say that again. You have to address that.
Okaori, giving and go for Okaori is totally wrong. There's nothing like Okaori. It's the frontal now. Oh.
So Okaori is just the fontanelle, anterior fontanelle. So you have heard of Awuje. How many of us have heard of Awuje? You right there, but heard of Awuje. So Awuje is just like a natural opening. We also call it the anterior fontanelle. That God has helped us to put the central part of our head, of our skull. So what the anterior fontanelle does is it creates a space for the brain to grow. So when the baby is born, you notice that when the baby is born, our mothers can use, sometimes they say they want to mold, they mold. Like if the skull is in one funny shape, they can actually keep molding the edge so that it gives like a more like beautiful shape. They can actually mold the head too. And yes, it's possible, because this in the development, the skull, this hard skull has not yet fully formed. It's still more of cartilage with some bony immersion, some calcium immersion. So over time it gets more harder. And as God has made it, because it's soft, it also has an opening. So this opening allows it to expand. So the main reason for the opening is it allows brain growth. Our brain, he said that within 1 to 2 years, our brain grow up to about 95% of its capacity. So by 5 years, your child can do almost anything. Can put in almost whatever in the brain and all that. And that's why we emphasize good nutrition. We've talked about a lot of things, sleep, between all those things that help for development. So the anterior fontanelle is there to do that. So, but sometimes when the child is not well fed, the anterior fontanelle becomes depressed. Yes, becomes depressed. So when it's depressed, it kind of becomes more prominent because it's not just flat, maybe child is not taking enough. So people feel that he has, because it's depressed, it's more visible, they now call it okaori. And the grandmothers feel that he needs about concussion, he needs about treatment.
Instead of food.
Instead of food. It does not need anything about anything.
And
Wow.
when they give the baby pap,
investigate the child and feed the child well. Because those pap, they don't have enough nutrition, they just carbohydrates. Breast milk has everything that the child needs. And some of them, they give pap, they give water. Maybe the baby's tummy is just 100 mils. So take 100 mils of breast milk, which will make baby grow well and all that. By the time you put 70 mils of water, it makes 30 mils. You now put 30 mils of pap. So 1 plus 1 is 0. The child will never grow well. You surely have the okaori. So it doesn't, but they just feel that over time they feel it has but it's not amenable to about preparations. I think that's one thing else that we should get over. They should just please, when they are worried, they should come to the hospital. I tell you, failure to thrive is real. And one thing is that once they fail to thrive, they will surely have problems with brain growth.
Does this kind of education go on in the
communities?
No,
social media space.
That's why we are making it available.
Yes.
Women in the hospital.
Yes.
Or in the pediatric section.
Yes, so that's why the nurses and all of us always advocate exclusive breastfeeding. So I think I agree with you that we should stress it more. I think we should stress it more because I think we just hamper on exclusive breastfeeding. Maybe we should talk more about why exclusive breastfeeding. Tell them more that look, if you give breast milk, the child's small stomach would have exactly what the child needs.
And again,
if you
the
give
cost of
something
okaori
else,
is this, and these are the solutions.
yes, if you give something else, the child will not grow well. Yes, we should also talk about those things, those common lies on like okaori, yes, and just and enlighten them on it.
Exactly.
I must say something that I actually have a close relative who actually had a child that wasn't actually going well. This child was feeding. We've heard of stories that they put the child on the breast milk for 2 hours. The child would feed and would not stop. Yes, we've heard of those stories. So for those kinds of children, please let them bring to the hospital. There are some other things that cause failure to thrive. So many other things. There's something called galactosemia. There are like disorders of some people have these intolerance. It's lactose intolerance. That they can't take milk. When they take milk, they feel passing stool. They will not tolerate it. So those ones can still do well with breast milk. So once you just change to any artificial milk, they start stooling. So those ones may also not grow well. They may also so those things should please come to the hospital while the child is not growing well.
Let's express questions.
Yeah, no.
Okay, yes. We'd like to move the question to the audience. Please, you have to accommodate
Anybody?
questions.
Okay, one, we'll take number. So let's go. 1, 2, 3. Well, so that I can take number 1, 2, 3, 4, 5. I think the people who have a lot of questions want to answer last. So is that all? No question from that side. Yeah, so.
All the message information will be passing, well understood. But I have a few which I think it must be shared. I have a well-grown up children. At the first 2 months, at the first 2 weeks they are born, I usually put a drop of honey, preferably pure honey, and I will just a drop, and I will rub it with an enamel. up and down, So by the time they are developing teething period, they don't develop malaria. If they want to develop, want to fall sick, actually they usually reflect sign of malaria and some other thing. Then on the day I notice it, I'll just put honey into hot water and then allow them to drink it. And that will usually happen when they get to 4, 5, 6 years. And I've never been a time when I took them to the hospital for sickness. And another thing I see observed, they are very, very energetic and very strong. So the use of herbs and some other things, I think is still effective to some extent, but you have to be considerate and put things in order. I don't know obviously orthodox medicine, but I think our herbs still Jamil. Thank you.
Okay, I don't use any medication, any orthodox medication. He uses herbs. When he has malaria, when his wife and child, when they have malaria, he will boil this. He said we'll just take a small cap, the cap like this from this bottle. Take just one in the morning, take one in the afternoon, and one in the evening. And it's fine. But it's because that's his area of specialization. Do we have people like that around us? There was a time I was working with Pax about something. There was a time he traveled to India to do, but I guess we are also receptive to things like that.
Yeah, the information is limited to him. Perhaps if he has subjected.
Yes, that's what he's currently working on in pharmacology in their department. So, and we hope that he get things done, get support, people to invest in it, so that it goes round and we can continue to use. We're not saying it does not work. It works.
I think
it does.
The challenge is why people are a bit scared or worried about the herbal is the sustainability, the consistency in terms of dosage, and the actual thing you are putting together. Will you actually always get it in those formulations, and will you sustain it? Because what you have, then concentration as well. You could get it in a diluted form now and it does not finish the job, and then it relapses. Or you get it in a higher concentration and it overdo the job. So those are the challenges around that. So maybe you will answer.
Thank you so much. Well, as we all said, nobody is saying apps, we are not training with apps, but we would have just loved it to be refined, regulated. But while we are waiting for the regulation, anybody that takes app takes it as open risk. So we will never say don't take apps. No, we won't say don't. I'm sure most of us were raised with
But if it comes with complications, you go back to the orthodox.
You can imagine. So why not just save yourself the stress?
So for the one of honey, I know honey is actually had a lot of healing agents. It's improved. One of our professors got his professorship on honey event dressing, the professor of plastic surgery. So honey has been proven. A drop of honey to your baby does not do anything, so that's not a problem. And you say you eat honey 4 to 5 years. I don't think they have malaria. It's just one small thing they have. I don't think it's malaria. It was really, so one of the things that happens, I don't think they had malaria. So I just feel that they can have something, maybe not malaria. I don't think they have malaria, because one of the things, don't forget that the advice is if symptoms persist. I'm sure I was
for 3 days.
When I did that, if symptoms persist for more than 3 days, consult your doctor. So because if it's something else, I just don't think it's malaria, but I accept completely. Honey is a beautiful.
And please, we should be careful where the honey is coming from. There are some that are adulterated, so let's be careful what we are consuming.
Next question. Good evening, everyone. I want to ask a question regarding that TT issue. So I want to ask her, is there general symptoms for TT?
What are the things you see
General symptoms
to confirmatory symptoms?
So there are no general symptoms for teething, But I can say that, as I said, sometimes some people have said maybe the child can itch the gums. Maybe the child can itch the gums, putting it under the gums. And yeah, some have said sometimes these things are not proven. They're not like documented. Like people have done research and they have found out like these babies, because they're taking they have low grade fever. But I've seen things like maybe the forehead of the baby is a bit warm, and you do everything. So I've had a few children. They come to the hospital. You do everything, you wouldn't really find anything, maybe on the children. So most of the time, let's just have it mindset that if we have, let's say there's lots of times that babies are the long and short is that they should just always be retrieved. They don't have a significant time. It's something else that is happening at that time. It's not actually the treatment. Let's just be very careful because sometimes
no two children are alike, just like our level of resistance are different. The amount of time it can take to walk before you break down is not the amount of time it can take to walk. How much stress I can take in a day is not how much stress another person can take. So that's just it that okay, this one and this thing you say is this no. So level of resistance differs.
Okay, Mr. Dayo.
Okay, so like I said, I have so many questions. So I think I have a question for each person, and I think some of those questions can be answered by anybody also. So let me start from the health insurance. So I think for enlightenment about health insurance, for me, not by also because I'm a civil servant, I have health insurance, but some people don't have access to health insurance. But so I think I would like you to please tell us the kind of health insurance. You already said the type of health insurance available and how can this health insurance be assessed. Very important for and what is some of the things covered by the health insurance. Let me start from there, then I'll ask you the questions.
Yeah, like I said, there are about 3 blocks that are covered in the society with different platforms of health insurance. Those in the active government work or organized private sector are covered under the formal sector social health insurance program, while those in the informal sector are covered under the platform we call GiveShip, Group, Individual and Family Social Health Insurance. They pay a premium of about 38,718 naira for now, individual per annum, while those in the vulnerable group, as the ones that government pay for them fully, those ones enjoy free medical care once they can. That's pregnant women and children under 5. So those are the different platforms for which you can go. And what is covered in terms of benefit package is virtually the same. It's comprehensive, it is robust, and it's uniform. What I mean is that you have access, once you are insured, you have access to care at primary level, secondary level, and tertiary level with the same premium. So all you need to do is that you have a gatekeeper, that is your primary care provider, which you pick or you selected at first. And if there are any need beyond that primary care level, then they refer you to a specialist at the secondary level. And then if there's need at tertiary level in teaching hospital, they refer you to at no extra cost. Then you can also enjoy the health insurance even outside your station. That's why it becomes very robust and uniform. So you can travel out of your station and then still get care at other hospitals in other states. So what is just not covered are very, very simple. There are some services that are duplicated, and so we don't cover it. Like TB, for instance, there are agencies that manage tuberculosis. Then HIV, there are also agencies that cover. Then epidemics or diseases that are Ebola, then Oh, the last one, COVID and all this. We have National Center for Disease and Control. So they manage that one. So we don't cover it under health insurance again. So, and then car racing, excessive sports, that you just go to boxing ring when you feel healthy and you break your jaw, we don't cover that. Then ailments like cancer, terminal diseases, heart transplant, organ transplant are also not covered because they will wipe off whatever we have in the pool. So these ones are the total exclusion. So,
thank you, sir. So, for I'd like you to talk about some of those things and how we can manage that. One, I also would like you to talk about how to protect defense mental health. Like, how do you know? Like you said, it's just now that, and I also observe, I also came to that knowledge that it's just now that this mental health thing became a thing. Before, nobody knew that there was things like depression, anxiety, just feel like just like happening to us. So, I would like you to tell us, how do you know when you're having anxiety, depression, suicidal, and all those things, and when that happens, how to deal with it? And just in my mind now, I don't know if we have.
Yes, thank you. I got that.
Okay. I don't know if we have like a mental health stations or clinic like or something like that in Nigeria. If we have, I think you can just point us in that direction.
Okay.
Let me read that for you.
Okay, thank you very much. First of all, let me take you from the last question. There are hospitals where you can access mental health services in Nigeria, and in Oyo State, we have a state facility, which is Adeoyo Ring Road. Adeoyo Ring Road. Adeoyo Hospital, State Hospital, Ring Road. I want to remember the full name. Yes. Then we have the Federal College Hospital, UCH here, where you can access mental health services. There are professionals there. We have the adult units and we have the children and adolescent units, where I am a graduate of. However, there are symptoms of mental distress. That was what I was asking, like, did I define the meaning of mental health? Mental health is ability to realize our potentials, our capacities, our capabilities. What exactly do you want to be? Are you able to achieve your aim? Are you able to set this goal that, okay, I want to become a doctor, I want to become a banker, and you work towards it? You are able to achieve. We have a lot of people who have dreamed and were not able to because they didn't have the mental capacity to achieve this. And are you able to work productively and cope with daily stresses of life? Are you able to cope with daily stresses of life? Okay, you wake up every day to do this. Some people are not able to. That was what I was explaining, that our level of resistance are different. But mental health covers 4 pillars, 4 areas. You're able to achieve your capacity, capacity building potentials. 2, you are able to cope with daily stresses of life. 3, you are able to work productively. And 4, you're able to contribute meaningfully to your society. Anything out of this, then the person needs support. Then mental health is on a continuum. There's no one that has the total good mental health, and there's no one that has total poor mental health. So it's either poor or good. So we have good mental health. I was using the example of Kanwan Koden. It's not as if he doesn't have good health, but it was until they did the investigation and found that there was a column in his heart which means it's not as if he was totally, but he was still moving. He didn't even know there was nothing wrong with him. So it's just like mental health, because mental health now, okay, let me use this example. You have an exam, and you know, I have exam anxiety. I have this every time, and this anxiety can be either good or bad. But the anxiety is good because it helps you to say, hey, lapo money.
It releases adrenaline.
It motivates
To motivate you to do what you need to do at the right time to achieve that goal, to achieve that thing that you want to become in life. That is what pushes you, is the drive that moves you to achieve it. But when it is too much, that now affects your daily functioning, your relationship with people, it is consistent, it is persistent, and it is everywhere you go. It happens everywhere you go, and in duration. It lasts more than 2 weeks, 3 weeks, then you need support to control it. When it now determines who you are,
to redefine you, depress you.
It begins to redefine you. That means it is a big problem and it needs to be addressed. You need professional support. Because there are different forms of phobia. Just as we know, some people are not speaking in public. Some people have phobia for going out. These are some aspects of mental distress. However, like I mentioned earlier, that maybe we should go to psychosis. So there are different forms of mental illnesses. There are, let me not say common ones, mild ones, and there are some form that prevents people from optimal functioning. They are cut off from the reality. That is psychosis. We have common ones that we know: anxiety, depression, phobia, postpartum depression. So some of those.
What of when you are bullied? Is it a mental problem?
Yes, because the person could be suffering from low self-esteem, and because of that, they are now playing it on other people before you get them. Yeah. Like they say, I did the mole or the moloko. It's a lie. The person cannot, but you know, when they want exactly, they want to go ahead. And again, this all boils down to problem in the family. It also helps us to see that there's a problem in the family, they lack love, or there's violence in the home, and they're also playing it on other people.
Reactive.
Exactly. So through conduct disorders. So there are also some mental illnesses. Let me not say mental illnesses, but they're called neurodevelopmental problems. That is where we align.
Yes.
Some children have neurodevelopmental problems like autism, OCD, ADHD, intellectual disability, and they're in different forms. It could be mild, it could be severe. They're all manageable, so that's aside. But for adult now, and I just said now, studies we're still looking at that there is adult ADHD. So we're still checking to see that is it truly going on, is it truly happening. So that's aside.
ADHD is hyperactivity. You see a child that cannot stay in one place for 1 second. He's jumping up
and down. So they take risks.
Hyperkinetic.
They do things that put them at risk, in problems, in trouble. So inattention in class, it could be, in fact it is a disorder. Sometimes it is mild. We can always do talk therapy to bring them to functioning. When it is severe, they need medications. Helping them to become useful and responsible adults, they'll be self-reliant. Don't be surprised that all these ones we see on the streets, they must have had ADHD then. Yeah, because no, sometimes that is what.
Some derail when they grow up.
Some derail when they grow up. Some get influenced, but you know, some of them must have had maybe one neurodevelopmental problem that were not identified, diagnosed, and treated. So when they now become adults, they're not able to go back to school and learn the basics that they were supposed to have learned in their early life. So that's about them. Then we have psychosis. There's bipolar, there's schizophrenia. This one affects mood. Mood. Yes. So we have bipolar when you switch between two poles. It's not as if you are this in the morning and you are that in the evening. No, sometimes it takes weeks, it takes months. When you have manic episode, you're just all excited. When you have no good reason. When you have no good reason to be. So it could be for, one could be for a month, 2 months, 2 weeks, depending.
But
The episode could vary.
The good news is that they have people that can treat these things.
They are treatable, they are manageable. We have people, you never can tell our status as we are seated here. You don't know our mental health status. So it doesn't define you. So that's what I was saying, that it is on a continuum. It could be poor, it could be good. Those you see on the street that you call, that name you call them in your mind, in your heart. Yes, sir.
This is a question. Sorry for cutting. Awesome information, and I love that. So the question is, I don't know that I was already in depression until whatever happened, I was able to figure out eventually. Now the reason I'm asking, because there are things that happen to us, or we could be in a situation that we don't know that particular situation has turned into a serious mental health. So the question is, what are the things we should look out for? Now, when this is happening and you are seeing this, that implies that you're already getting depressed. When this is happening and you're already seeing that implies that anxiety, bipolar, whatever it is. So let me just say, basically, not necessarily that is all, but basically things we should look out for that will.
Okay, so that's actually where we're going, because I just explained one part of bipolar. The other part is depression.
From a patient,
so the
I used to know that
okay.
shows some of this. You see, the first thing you see is that person begin to
withdraw,
begin to isolate him or herself, and you keep wondering, wanting to be alone and thinking over, then you find that the person who is not looking his cheerful ways before. Somebody who used to be cheerful is no longer cheerful enough, and then he begins to be suspicious of everyone, starts getting suspicious. What is this? Withdrawing and then wanting to be alone, not wanting to be in it. So these are some of the things you start getting that start telling you something is happening.
Okay, so thank you very much. I was going to get there.
Yes, sorry.
So depression.
Let me just.
Okay.
She said something about when this thing starts lasting for about 2 weeks.
2 weeks, duration, persistence.
You know that, yes.
So it is affecting your functioning.
Exactly.
You are not seeing, or people around you are not seeing you as who you used to be. So I'm just giving you different forms of mental illnesses.
Really, are you here?
Which is bipolar, like I said, is on 2 poles, manic and depression. And yes, they can say it is mood swing for layman, but it's okay, we can understand. So depression is loss of interest. When you have loss of interest in things that used to bring you happiness. Can we have someone tell us what you like to do in your free time or to relax?
Take me out.
Okay.
So jazz, take I'll be so excited.
Okay, he will be so excited. So when I take him out to that same place, give him give him everything that used to bring joy and happiness to him, and he's not. You see that there's a problem. Then when the person is always talking about, okay, then sometimes they become very tired. They haven't done anything, but they're just tired. They feel unmotivated, hopeless. This life, God said, what is going on? Then they don't keep contact. They don't keep contact. Someone that will come to work and say, guy, how far now? You give 5. Just come in, go and sit down. And it's consistent. These things, like I said, that it's not just one, so don't go and start diagnosing people. I'm looking at your faces, and it's looking like we are already training professionals to diagnose people.
And start concluding that this person is depressed.
You can't diagnose somebody, you must come to the hospital, please. You must be a professional. So, if all of these things happen consistently and it affects or it causes impairment in your daily functioning relationship with people around you, then it is a problem. If it is consistent everywhere, it's not just because you are at work, that is why you are not talking to people. Then they tend to lock themselves up in the room, they tend not to do anything that brings pleasure, they don't keep friends anymore, they don't even go out. Some of them will even refuse to eat.
Yeah, I think something we need to look at from what she said is that, like Dr. Just chipped in, the duration is important. It's not that maybe when I scold somebody now and the person withdraws.
So bad.
Just temporarily. And I say the person is depressed.
No, the person is not.
You can just scold somebody and the person wants to reset his brain and see why I've done that thing wrong, and then maybe then you start saying, you are depressed. No.
It must have happened for a period of time, consistent in all places, in all occasions, at home, at work, at church, at mosque, and everywhere they go. So there's a big problem. There's a sign of mental illness. Then see, there are different forms of emotional distress. Anything can affect our mood, feelings. Mental health simply means our thoughts. How our thoughts affect our feelings, our behavior, and how we relate to people around us. That's just a simple thing you should take home.
Okay, another thing is, there are some triggers. Somebody's business is flourishing now, and maybe just traveled and something happened, lost maybe about 50% of that. The person can withdraw and start thinking, will I ever make it again? And so, I don't know, maybe over the period you can conclude.
Okay, so
you could have some challenge.
What you just said now, a stressful life event, traumatic and stressful life event. Stressful life events are traumatic, stressful life events are things we do not expect will happen. But happen suddenly. God forbid if one loses his or her job, unplanned, and your house rent will be due the next day.
But it will hit you.
It will hit you. You start thinking, like, before you know it, the car you thought you were saying in your mind is already coming out. People are already hearing the car. And every time, people that you see around the house, Baba, well done, sir. You just pass inside that you will not even know you saw a light. Because you are lost in thought, you are thinking everything has gone wrong. You begin to talk to yourself, and if it's consistent for a period of time, then
some fail exam and they say they are going to commit suicide.
They say they are going to. So sometimes people who are depressed sometimes may feel, because of their hopelessness, their feeling of hopelessness, feel that okay, let's end it. They start to plan suicide. They plan suicide. And when they start to plan suicide, let me give you tips. They prefer to be alone. Then they'll start hiding things in the house. So that when you are not at home, they will plan, they don't want you to be at home. And when they have planned how they want to take their life, they are happy. You think, this person is back to life. It's smiling today. You don't know that it's smiling that my days are numbered. The days are numbered. You just leave home. You just tie. And this one that social media is also not helping. It's not helping at all. A lot of them get bad news from their friends on social media, body shaming, bullying on social media, oppression. They see this, you have this, I don't have, Like I said earlier, that our level of resistance are very wide apart. And that also determines our prognosis, whether good prognosis or bad prognosis when mental illness comes.
People run into depression when they are jilted.
So when I said the person lost the job, it's a big problem for some people. But for some people, they'll be like, "Bah, we should turn. She did my job. I can also now."
The threshold.
They move on.
Some don't have any.
Exactly. So anything can happen and push anyone to have mental or emotional distress or mental illness. So it now depends on our level of coping. That's why we're also encouraging that you don't use maladaptive coping mechanism. What do I mean by that? Some of us are coping on substance. I just heard now through the training that some people now have they use synthesis on their skin. For what? To cope when they feel bad and the lies. Yes.
Keep them on.
To make them feel good because of their bad behavior. And energy drink is everywhere now. Predator, Coca, and a whole lot of others. What is going on?
Well, what is the eventual effect of those energy drinks on your brain system? Is it that it will result to addiction, or it will have a much more bigger catastrophe?
Okay. You know, the body releases metabolism. Anyway, this, I don't think that will get that. But you know, the neurotransmitters, it alters them. Something that's supposed to be walking like this,
No.
that's supposed to be moving small. You now do something,
Shoot it up.
within the next thing, because of this intensity that they are giving you, like to do a machine that you're supposed to be using small, your generator, the manual says use it 5 hours daily. For you are using your own 24 hours daily. You all know what the answer is, Abby? Mental illness. So that's why they end up on the ward. For those who get care, who get support. So let us not use substance to cope. There are other coping mechanisms that we can use. Rest, play, go for recreational activities, be gist with friends, associate with people. There are support groups around. Just like this, that is helping you to say that, see, don't worry, life will be better. When Nigeria wants you, don't panic. All is going to be alright.
I saw something about on the internet that also giving thanks.
Give gratitude.
Give gratitude.
Yes, gratitude jar.
Now think about the things you have when you're down, and that person that. Did you hear recently that about some 2-3 weeks ago, a medical student in UCA?
Yes, through Aiko.
Yes, lost his life.
Aiko. So that's why I said no, it's Aiko. That's why I was saying that social media is also not helping.
This was just 2 to 3 weeks ago, so they did not tell me. I saw that. I saw when the guy died, they brought to UCH. He died in UCH, and I saw some of the medical students' colleagues who were trying to get his corpse out. This was just 2 to 3 weeks ago.
Was he overstretched, or he took his life?
He took his life because he was not passing exams.
Those are
just the things that some people, the stressors. And we tell them that 90% of the professors now usually they all fail exams. So it's not a reason for you to
it's a routine thing now.
I failed once.
In the routine, is not anything special that you failed. It's the going back to say yes, you can still do it.
And unfortunately, the society is not also helping. That you must always man up, you can do it. Don't open up. Open up. You know it is strength to ask for help. I hope you know that. The person that asks for help and gets help is the strongest, is the bravest, is the person that we should say, Organa man. You try. So please, let us reach out. Please reach out. We are always available. We are here. You find us on social media. Please, we are available, and you can come to UCH if you have children who need support. CCAM clinic, the psychiatry, Department of Psychiatry. Then we have in Adeoyo too. So please, for God's sake,
Can word of affirmation work on this issue?
Word of affirmation can work. Then if you feel it works for you, it depends on individuals. But it is good when, for instance, this boy that took Aiko, the medical student, if the parents have always told him that don't worry, you can do it, you are the best, you are the greatest. He may not get what you want now, but it will still come. And failure doesn't define you. It helps you to grow stronger and better. And you know, sometimes you may be looking this way when God wants you to look the other way.
Absolutely. So I've had medical students that dropped out, and they are the best in where they are now. Even those doctors who even come to them, please come and help us. So what are we talking about? They are even more successful and more, like I have one of them that eventually did English at the first class. He's everywhere now. I have one that went into business. He's a big time. He's going to buy all the professors, buy all of them. No, that's the truth. So it might just be that, look, it's not everybody who's in the medicine.
I don't even want to ever become a medical doctor. I want to be in the community. I don't want to ever work in the hospital. I want to work in the community where people are afraid to come to the hospital.
Yes.
So to demystify those norms, those things that they say, anybody that get madness like this, they know they ill, that they will never get cured. Mental illness is manageable.
Okay, thank you so much, ma. And Mr. Dayo, you have done half time. We'll come for half time again with you. And you know why is that doctors might have an emergency at the hospital. Like I said, health workers are one of the most costly people to have them in the room.
I can take one of these questions.
Yeah, I know, but I have other people that also have questions for you.
Okay.
Only if I don't have anybody with questions for you. I know you only have 10 minutes left with us. So, ma, sorry, ma.
No, I also have to leave.
No, I know. We'll wrap it up. We'll wrap it up all in 20 minutes. So 10 minutes for you, for all the questions for you, another 10 minutes for her, for all the questions for her. I'll take all the questions once, and there will be a response to all the questions once. So now, Mr. Dayo, I'm coming back to you. So,
I'm not with her.
so only the two of them, you have questions for him. For him. Just 10 minutes. You have questions for him, ma'am. Okay, so let me add. Do you also have questions for him? So I'll take the 3 questions
I don't have
together.
questions again.
No, they are coming to you. They are coming to you. It's 10 minutes for him and 10 minutes for you. And we are done. Sorry, ma'am. So, all your questions are for him.
Good evening, everyone.
Sorry.
Good evening. My name is Azuki Odoye. I'm a diet chef and a restaurant owner. And
by that GT Gallery Mall.
thanks for the free adverts. And one of the core things that we do in my organization is that number one, we educate people on how they can eat healthy. Regular meals. It doesn't have to be exotic or important. Just eat good food. Eat your eforiro, your egusi, pounded yam, amala, pap, and all of that daily. And then in Ilion Jabara, the restaurant, we ensure that our meals are so affordable. The statistics now from PG Test, I saw it today that only 5% of Nigerians earn 1 million and above monthly. So if you earn less than $1 million, how much are you spending on food in a month? Especially for creatives like this, middle class, young professionals, startup ecosystem, that they are still hustling. Are they eating well? Some of them resort to chunks, let us buy Coke and Gala to hold body till when and all of that. So we make products available for them to eat. As low as 1,000 naira, you can have a complete meal at our restaurant. So my question is that in your capacity as a mental health, as children, yes, as a restaurant owner, I do shopping as well. I go to the community to buy stuff that we use at the restaurant. And these days I noticed, before you see mothers, you were even saying pap is stash. You see mothers giving their children pap, but it's so sadly now you see mothers giving their children, toddlers, biscuits, Coke, and all of that. So in what capacity are you educating? Are you waiting for them to come to your facilities, then you give them education, you educate them, or is there a way that you reach out to them? Yes, even hard too, because mental health too, it comes, some of those things that when they eat proper food, so it helps a lot, especially the creatives, all this anxiety and depression, they sit in one place all day without eating proper food continuously, lack of sleep and all of that. So I just want to know if there's anything like that, my organization will be willing to collaborate with such initiatives.
Your question, sir. So, okay.
Alright, good afternoon, everyone. My question is, when does malaria get to a point where it claims someone's life or leads to mental illness? Because I have a female friend whose younger sister died of malaria plus, and recently there is a research that malaria can also lead to mental illness. So it's not everybody that goes mad that was using drugs or that is village people. Some people, malaria can actually lead to. So I want to know how, because this family is not a poor family or an average family, they have money. So we can't say they don't have money to take care of their child. So is it that the malaria plus is a different strain of malaria, or they just use normal anti-malaria but couldn't work? So that, because this can take people's life and you start wondering, but already gave the child this malaria drug, and what's going on? The child still died at the end of the day.
The next person.
Good evening, everyone. I want to say a big thank you to our panelists. I have 2 questions. Number 1, I would like to ask for your opinion as regards the use of herbal medicine for prevention of diseases and infection, and not just healing. Because when I was young, I think there's some code that they give us to prevent some diseases. Number two is about our smartphone and mobile devices. Is it true that it's increasing mental disorder? Because right now, many people find it hard to focus, find it hard to sit down and work for long hours. And there's also algorithm on this platform that just make people, before you know it, 5 hours.
So, Mr. Dayo, one question for the pediatrician before he leaves, so that we can.
So, he said just one question, so let me say again. Okay, let me just ask this very important question, among the other question. When I like the way you're already trying close to 40, let's say 35 or more, then you realize that it's very important for you to be thinking of your health. So at that stage, what are the things you need to, that is very vital for you to look out for, and things that need to be done when you get into that phase? That question, and maybe before and after. Yeah.
Ask more questions.
Okay, so let me also ask that question, because I know you are asking. I have a question. So my question is this. I think most of us don't know when to pause. If you observe that I was mentioning Mary in between the session, sometimes she will come, if she has the power to throw me off the window and say, Alain, just go and sleep. But unfortunately, she's unconsciously learning the same thing. Do you understand now? So now, we don't know when to stop. And when I see creatives, the first thing that damage and we don't know is our eyes. Then our spine. It damages every day and we don't know. What are the we can't stop us from the screen. You can't stop us from that long hour sitting. What can we just do to survive and not have complications?
And the food to eat.
No, you see you okay on that. Okay. I'm sorry, just a quick one. This man is Ayeko. So if we have any of our health professionals who have the time to talk, they have a series for education. Like the word says, Ayeko, so truth must be told. So you can invite them at your own time. You are free to explore a topic. It's a free thing for every panelist on our session. Okay. Just book a time. They are going to come and they are going to create a advert for it to make sure that your message gets to the public.
Okay.
Thank you.
Thank you so much. This has been this has just made my day. Thank you everyone. The contribution, the questions are fantastic. The questions are just very, 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 very important. And I'll just start from Ilionje. I'll have to visit because I don't want to eat I don't want to eat too expensive food. And maybe I'll do the Kaikong if you have it, or if you don't, I'll do whatever you have.
Man must not live by bread alone.
Yes. So the question you asked, I can say, is extremely important. I found those things so practical when I was in Onu Memorial. You see people, they come to the hospital, they buy puff-puff for their children, puff-puff and Coke. How much is puff-puff? Maybe like, say 100 naira, 200. You could just have bought moi and akara and the pap with the 200. And the child would have had proteins, have had fats and oil, and would have nourished this child's brain rather than buying puff-puff. It's just flour and sugar. So our question is, let's not forget our question. Our question really makes sense. What are we doing to put this thing out to encourage the public on eating healthy? This biscuit she talked about is so practical. We just take biscuits. So take biscuit, just give something else that is healthy. Maybe the akara, if you're in like an open place, and oats and all that. So I think we're not doing so much, and I think we need to do more. I'm so glad you said you're ready to partner. I think one of the things this forum has helped me is has opened my eyes to the more things we need to do in the antenatal clinics, in the postnatal clinics. Let me say, unfortunately, so the way these things run is that antenatal clinics, mothers come, they have antenatal study every week till maybe they are from like 36 weeks. A mother is expected to come every week she delivers. That's 36 to like 38 or 40 weeks. So every week she hears something. Every month from maybe about 4 months, she listens to something. We need to start putting these things. We need to start talking about postnatal care, the calories, the teething, the herbs, the good food. We need to start talking about it. Then, like for children, we usually just have postnatal clinic, which is 6 weeks. But we have immunization clinics, which is so I think we need to all go back. I still remember today that the private hospital close to my area where I sometimes looking, and I branched there, and maybe it was yesterday night. Okay, I can't remember. I branched there and I found that a lot of children came for immunization. 6 weeks, 10 weeks, 14 weeks. These are the times we should say these things. So I think we all need, UCH has 2 big immunization complexes, IGMOB and Institute of Child Health. We need to just go back there and tell them about these foods. I'll try that, and if there's a place Millie can collaborate, I'm so glad to invite you to also help. Thank you so much. That was very, very beautiful and important. Malaria. There are like 20 things that tells us that a child has severe malaria. So we have 2 types of malaria. We have uncomplicated malaria and severe malaria. The way we ask our young medical students is, I'll ask, what makes malaria severe? And I expect you to tell me like 20 things. So they come things like multiple convulsions, loss of consciousness, jaundice, shock, hypoglycemia, prostration, acidosis, hypoglycemia, severe anemia, and all sorts. There are like 20 that can happen. So when a child has malaria, proven by the child comes to the hospital, he has maybe a fever or any symptom, you do malaria test and it's positive. And you have something that shows any of these things I've mentioned, it is severe malaria. It is not ordinary malaria. It is no longer ordinary malaria.
The test will also have shown high positivities.
So, one of the things the test can show is hyperparasitemia, which is a lot of malaria, but that is just 1 out of 20. So, when a child comes, if a child is vomiting all through, everything is most likely severe malaria. If a child has hypoglycemia, it's most severe malaria. So if a child has frustration, inability to sit or stand, and MP is possibly severe malaria. Now to your question, there's something also called cerebral malaria, when they lose consciousness for some time, for about 30 minutes, and we find out that they have malaria. Now what happens is that if this child goes to a place where they didn't pick on time that this is severe malaria, and they just think, it's just ordinary malaria. When a child goes there, the child has had convulsions or has jaundice, or is passing dark colored urine, and they still give oral tablets, and this thing goes on, like that family you talked about. It goes on, that's the only way I can explain. It goes on, it can cause cerebral malaria. The child can lose consciousness. By the time the child loses consciousness, what usually happens a lot of times is poor care, poor treatment. It's so terrible. I think it's even poor treatment, because if the parents are aware, they take the child to the hospital, they go to the hospital. Some of them, if the child loses consciousness, there are different kinds of fluids that you can give. Some just pump different things to cause some electrolyte derangement and all that. Those things can cause complications, cerebral edema, some cause cerebral, like some brain swelling, and I tell you, the child may die. So that might be the scenario here. So I still think that when a child is ill, I tell people, you go to the health center, they give medication for 3 days. The child is not better. Please, go to UC, go to Oni Memorial, go to So you can go to Oni Memorial, you can go to Oni Catholic Hospital. There are some good hospitals, Moon Specialist Hospital. Yeah, some people have issues with them. Let's not just talk about, because delays and all that, there are so many papers.
Yeah, I think usually the challenge is financing the care.
Yes.
And that's why we
They're not
are introducing the health
Yes.
insurance to you. So when you are on health insurance, then the bill is low.
His bill is low. Exactly. That's one of the things that also make people go on time. So when they don't go on time, or when
Because
they
they're afraid of the expenses.
when they are mismanaged. So what's the solution? People should learn that they have to go to the right places. Please don't be afraid of this age. As far as we know on strike, we will take. We overwork ourselves, but we will take.
And especially for children, they don't joke with children. OTQ is always open, always.
24/7, anytime. Somebody came and said, "We think no work on public. We don't want public waiting. Public holiday, we are there."
Even during strikes, severe strike, they are there.
We don't, a lot of people have called me, asking my child to OTQ, but they will not answer me. Just go there. They will answer you. When they don't answer you, they call me. And most times they'll go without calling me. So our question on, what's the question?
The first one is about medicine for prevention.
Yes, for prevention. Yes, one of these people about prevention. I would really say that they don't have so much benefits in truth. I think those things are they are long-standing beliefs that you find out that something happened at that time. That's why they believe that, and it's not really like it's true. About concoctions, we don't want our babies to have about concoctions. First 6 months, breast milk only. Because any small amount of herbal you are introducing for us is taking space of breast milk. And you're already compromising the child. So we just want only breast milk. And those herbals, they do well without the herbals. So don't bother giving the herbals. So we should just... For adults. For adults, well, I think I'll give adults to... about concoctions. For prevention. For prevention of things like what is it, pile or fines?
Losing.
Detoxification. Yes. Actually, my brother, my elder brother, anytime we come to during Ileya, we all come together, that's how we see ourselves. He was like, you have to be taking this thing like every 6 months. No, every 6 months, or every 2 months. Like, you know you're taking a lot of sugar, you have to be taking this thing to detoxify.
Exactly.
I'll just be like, yeah, I don't used to take it though. Thank God. I don't think I'll go find it yet.
So what I don't know. One of the solutions is you drink
water.
So much water so that you can avoid constipation.
Constipation, then you also detoxify. Water also clears your. So I don't know. Maybe there are more researches and there are.
Just comply with water therapy.
About vaccines.
Are they about
vaccines?
Vaccines?
No,
about
not
vaccines.
in Nigeria that we
That
know.
we are aware of.
Somebody told me he used the Chinese drug for malaria, and since 2021, the person used to have malaria frequently. But since 2021, the person used that Chinese.
Was it a vaccine?
I don't know if the
And
vaccine. Malaria.
So I tell you that person is not sleeping when the mosquito is biting. I can bet it. Let the person come to this where there is mosquito.
In this tropics.
I was even going to say that it's possible if the person is no more in Nigeria.
So then your question.
It's a question on
mental stuff. She'll take it. She'll take it. She's a mental health expert. So the question on, yes, beautiful question. The question on, by the time I get into 40, what should we do? Like, if there are things that will count in my brain, are things like exercise more, alcohol, step it down, take it away, smoking, take it down, take it away, foods, your salt in your diet, reduce it, take more of fat, take more of fats, just the same thing, reduce foods with fats,
take nuts, take more nuts.
Reduce all those fatty foods, raw meats. So those are the things by the time. I remember we had the get together in my school. Okay. And came from command, so we generally have these get together, and most times that's what we talk about. Especially when we're like very 40, like guys, You are getting old, though. Don't say you are not old, though. So we talk about lifestyle modification. So hypertension is setting in earlier, diabetes is setting in earlier. Even if you have a family history of those things, when you exercise more, you watch your meal, you have less risk of getting it. The smoking, alcohol intake, there are risk factors for hypertension and diabetes. There are risk factors. So if you do more of those things, you're likely to actually get that, especially when you have a background genetic predisposition. Then his last question was the creatives. The creatives. We cannot stop. When do we stop? So for me, my advice for creatives is start taking the precautions from now. Do you get? Yes. It's difficult to tell them to stop. I'm sure it's difficult to tell you to stop. You want to keep doing so that as much as you can help in the community. But we have to start from. So like if you look at this seat now, sorry. Yes. This seat is merged forward. So they did it like that, the back rest. So she sits, supports her back. So let's look at those that sit in our offices. At home. At home. They have that. Look at your car. Your car has that backrest. Because they made it like that, like you need something to support your back. You don't want to sit like this. If you sit like this for too long, you're surely going to injure your back. Your eyes, you are on the screen every time. You need to watch it, especially when there's any sign. You get to take care of yourself. We need to take care of ourselves. But a lot of times we need to look at those operational hazards and try and address it. I think I've been able to say a few of them.
Yes, sir. Thank you so much. Thank you.
Okay, I think you have answered most of the questions.
No, I've left all your questions.
Oh, okay.
Then, can I please beg to leave? I think it's so much. But the sense is not so many.
Yes. I guess I only have a question from her. Or if we are open to collaboration. Yes, we are available. Just like we're invited here today. You can call us at any time. Basically, we work in communities. We work in communities because people are afraid to come to the hospital. So we do advocacy in the community where we identify these distresses. Some of these symptoms, we teach you how to identify the symptoms. And when you find some of this, you call our attention. We do basic assessments. If it is mild, it can be treated in the PHCs. We even train primary healthcare workers to be able to respond to mental health needs of people in their community. We've done this in Oliole, Ibadan Southwest, Ibadan Southeast, where we are working currently. And we even picked, we did a project where we picked 140 people with mental illness. For about 1 year, we journeyed with them medically, psychosocially. In fact, we taught them how to plant what they eat, because feeding is also part of our mental health. Because if you don't eat well, like it happened sometime in Ibadan where an old woman, she had dementia, so she left home, the part of the brain forgot the way home. She forgot her way home and in gate. So because she has been away, nobody gave her food. You know how we say old women are witches here and the like. So they didn't give her food, nobody supported her. And because she's been starving for days, she started, talking irrationally about things that she didn't actually do.
Mental stress.
Because of dementia. And she was burnt. So some of these things we teach them in the communities. So we are available. We are available at any time. Just call upon us. So we have people that we supported throughout, and those communities have owned community mental health now as their own. They even call us, okay, we have somebody we saw, send them to us. Usage. Adeoyo, Dr. Fakunle, that's the person we work with in Adeoyo. In usage is our own personal place now, our own personal food. Because these people, they need to take medication, but they don't have money to afford, because our medications, it makes them eat. So they tend to eat a lot. And they can't continue to buy 1,000 naira food. They can't afford it. These places, they are rural places where Some of them cannot, they don't even make 200 naira in a day
So
where they work. Some of
they
them,
can teach them on local things
yes,
that can actually
gardening.
help sustain them.
So we did gardening with them. Plant ewedu. Once you have gari, ewedu is perfect for you. Mix ewedu, put small salt, put small locust bean, put what's it called, palm oil, put atagibu, your food is ready. Ilawa said, well, plant okra. It won't take long before it is ready. Plant corn, plant vegetables. So this will also supplement your meal and you'll be able to live better and function well. So I guess you asked the question about mobile devices.
Is it addiction? Your question is about addiction.
My question is, do you think they are leading to increase in mental disorder?
Okay.
Where people cannot focus,
Studies are still
they
going on.
can't work for a long period of time.
Studies are still going on. Yes, studies are going on. You know, like I said earlier, that it could be a positive and a negative. It depends on how you put it to use. And now, you know, there are a lot of apps that makes our lives easy. You know, I just learned recently that you can do slides, complete slides with AI.
Sure.
It makes life easy. But it also makes us lazy, you know?
Well, when I was coming here, I was already thinking of doing slides with AI.
You will task your brain to prompt instead of you manually designing.
But we have schools that are using AI to write pieces. That means substance. We lose substance. The importance of research in our society. Because AI generated, it will not go to the field for you. It will just generate something.
It's using the existing data.
Exactly.
So, and if the existing data is wrong,
It's only new data.
It will give you
So what is the future of our society? However, it could be addictive. It could be addictive, especially for these young ones that all their life is on social media. If they eat social media, if you say, oh, I ain't on social media, they're in trouble. They will not eat for days. They will not sleep. So it's possible, and this still boils down to our level of resistance and how we take care of ourselves. Our support systems available in our society. When you notice this in this person, what is going on? Is this social media?
Yeah, please let me ask Doctor on the pediatric section.
Yes, sir.
I saw something on the social media. A child was just denied the use of phone or laptop at the time, and it destroyed everything in their home just because he was that thing was taken away from him. Then again, I also saw a child in UI here, a child of just 4 years, was so glued to it that there was nothing the dad did not do to just take it away a minute. She would not just agree.
It didn't start in a day.
Yeah, so I'm saying for developmental stage of a child at that level. Now, what do you think is the danger with this?
Okay.
I think maybe because of our time, maybe I'll just use 1 minute and maybe we should just round off. Okay, so I'll just say that there are WHO recommended screen times for children. In fact, those very young ones, they don't even have, all those less than 1, they shouldn't even have any screen time. They shouldn't even be exposed to screen at all. Is that much? But you can check screen times and age group. Thank God, I have children and no phones, no smartphone. Do you know how much children struggle with your smartphone when they get home?
Yeah.
And one of my sons will wake up in the middle of the night. 2 to 5 a.m. is on your phone. You ensure he sleeps early and like 2 a.m. Anytime I wake up 3 a.m. I don't see my phone like this guy, I'm going to look for him. He'll just go to one of the rooms, just cross his leg, he's on a game because he has to finish that game. He's actually very smart, but this is me not even giving him the phone. This is him trying to just get the phone. What if I give him the access?
Oh my God.
He's addicted already.
Honestly.
He's addicted already. So, and I actually remember that growing up, and when I was just kid, I used to use my money to go and play Mortal Kombat and Street Fight. Even in my time,
Like
I'll go and
father,
pay. I'll go and pay to watch to play those games.
like
So
father, like son.
those things are actually very addictive.
Honestly.
So you need to prevent those children. No phones till
You know, my worries is that
No
for a
smartphones
child at that
till
level,
straight up.
what is the implication of the distraction it will have in their
It could
development?
cause intellectual, it's possible, it could predispose them to ADHD. Because they now lack attention. You know, all these small videos and those actions going, they want to also see it in their teachers in school. So they don't pay attention in class.
Exactly.
And they're not able to, quickly, teachers write on the board.
Yeah.
They will be so slow.
Yeah.
They always,
They are distracted.
they are always looking out for time when they go out to play, or when they have access or time when
Concentration is
they
elsewhere.
So the concentration is very low and it could affect their learning.
Those are the things
It could affect their learning,
Thank
their learning
you.
performance in school.
Thank you so much. Thank you so much, sir. And at this point, I think we can't exhaust it. Like I said, we'll crave for your indulgence in your respective 3 hours that you want to talk. Ayeko Talk will come to you. You don't have to come down. Ayeko Talk will come to you, and Ayeko Talk will come and just prepare your topics, sir. Just prepare what you want and awareness to do. They will come, and because we need you in the public to educate us. A lot of us are ignorantly doing a lot of things, and of course, the other questions we ensure we gather them and send to you. If you can prefer answer via voice notes, via text, because we know there are questions online, so we'll definitely get everything to you. And if you want to talk to the camera, Ayeko Talk will be willing to come. Thank you so much.
Thank you so much.
Thank you so much.
Thank you.